So today we're here to talk about COVID. Most of us are confused about COVID, so we're going to talk about how to safely reopen with resiliency. My name is April Ambrose. I'm a lead fellow and a Green Classroom professional. I am the first employee of Integrity back in 2007 and now help to sell our energy and sustainability services. I also founded our Memphis office. I also have with me John Wixon. John, you want to introduce yourself?
Yeah, how's it going? I'm John Wixon. I'm the Regional Energy Service Director for our Kansas City office.
I have John here as my technical expert to weigh in if I say something incredibly out in left field. But otherwise, let's go ahead and get started. So the first thing to note is obviously 6 or so months ago, COVID wasn't on any of our radars, and now everything has changed. And the important thing to note is that we're all learning as we go. There's a ton of information coming at us on when to reopen, why to reopen, how to safely reopen. So that's what we're here is to talk through this. We want to do everything we can to help eliminate the occurrence of COVID-19. But since we can't really eliminate it, we're going to help reduce the spread. So all of the things that we're going to talk about today have been developed using the best practices and research from the CDC and other World Health Organizations. But at this time, we cannot claim that these practices will eliminate COVID from your facility, but they will definitely improve your indoor environment and reduce the potential for the spread of COVID-19 and other infectious diseases as we get ready to enter flu season. So a little bit of a primer. How small is a micron? Well, the virus itself is less than a half micron in size, which makes it too small to travel very far on its own, but it can hitch a ride on particulate matter in the space, like dust and dirt and respiratory droplets. So the more particulates you have in your space, the more likely the virus will transmit further. So there you can see a dramatized version of how small a micron really is. So respiratory viruses are spread from person to person through a few modes of transportation: droplets, aerosol, direct and indirect contact. And each of those has to be mitigated differently. So droplets is probably the largest virus carrier. Now, the good news is they generally fall to the ground within a few feet of the person expelling them, talking, singing, etc. And the way to mitigate that transmission is social distancing, wearing masks indoors, and ionization, which we're going to talk about later. The aerosolized droplets can actually hang in the air for up to 3 hours. Ionization can pull those down to surfaces, which can then be disinfected. And then we can also mitigate aerosolized through proper ventilation and filtration, which we're also going to talk about. And then there's direct contact. So that's changing behavior that discourages that close interaction. So I know it's hard for y'all, it is for me too, not to do the handshake or even the hug, but that's the way to mitigate those. And then indirect contact is mitigating through high touch surfaces. So we're regularly cleaning those surfaces or even having no touch surfaces. So now let's talk about indoor air quality. These go closely aligned with buildings. So indoor air quality is the quality of air within and around buildings, and especially as it relates to both the health and the comfort of the building occupants. So outside air is, as we all know, rapidly declining worldwide from pollution, mostly from human activities. And it's the leading environmental cause of premature mortality in the US. Polluted outside air combined with factors like poor ventilation, indoor combustion emissions, leaks, and VOCs or volatile organic compounds are what are contributing to that poor IAQ inside. In fact, indoor IAQ levels, the VOC levels can be 2 to 5 times higher indoors than outdoors. And we also know that these can cause health symptoms that lead to reduction in work productivity and, of course, sick building syndrome. So why do we care about indoor air quality? Well, 90% of our time is spent indoors. In the US alone, more than 120 million employees spend an average of over 8 hours working in a building per day. And in addition to that, staff costs typically account for 90% of the building operating costs. So, you know, the indoor air quality can have some immediate and long-term effects on individuals. Immediate could just be irritation of the eyes, nose, and throat, maybe headaches, dizziness, fatigue. Long-term effects, respiratory diseases, heart disease, and cancer. So a healthy work environment is important to give a sense of well-being. We all want normalcy right now. We want to feel like we're in a safe space. It also supports social equity for more vulnerable populations and reduces costs for a business. Now, this is where it gets hard to quantify. If I increase productivity, how do I quantify that? Well, there was a study that said if we just spend $40 per person per year on indoor air quality, that could result in $6,500 worth of increase in employee productivity. It reduces morbidity and absenteeism, and it also reduces presenteeism, which is coming to work while you're sick, which we do not want right now, obviously. People who work in well-ventilated offices also have better cognitive function and fewer headaches and respiratory complaints, and even sleeping better at night. Change is in the air. So these are the things that we're going to be talking about. Most of our buildings are using HVAC systems, and so those are going to impact our outside air dilution and our air filtration, which are key components to mitigate the transmission of these airborne COVID particles through the recirculated air in the buildings. It is important to look as well at our cleaning practices, at how we move through buildings, and then confirming all of that through IAQ testing and potentially some forms of re-entry certification as well. So this image shows how all of these different things can work together, but ultimately we don't need all of these. So I could do surface disinfection, or I can do UV disinfection, which also kills things on the surfaces. So, you know, what we want to start with is removing pollutants from the building. So how can we get particulates out of the building? Through cleaning, through walk-off mats, or like in your home, maybe taking off your shoes as you enter the building. Air dilution, we're going to increase the HVAC to increase the outside air. We're going to maintain, at the same time, optimal antiviral humidity and temperature conditions. And then we're also going to filter. And there's a variety of different types of filtration that we're going to talk about. But all of these are important and can work together if properly applied. So let's talk air dilution. The first thing is to bring in more outside air. We all feel more comfortable outside in the case of the virus, and that's because the air is so significantly diluted outside. We also want to dilute it indoors. However, we need to maintain humidity levels. ASHRAE recommends 40 to 60% to reduce further that transmission, again, riding on the water particles in the air. We can use indoor air quality testing as a guide to help us know how much outside air to bring in. So if we measure our indoor air quality and we have high CO2 levels, then we need to dilute the air. We also need the humidity and temperature to be at the right spots, and that tells us how much outside air to bring in. And then the same thing for measuring particulates and volatile organic compounds. The image that you see on the left here is showing a study of 10 coronavirus patients from 3 families that dined in a windowless restaurant on the 5th floor of a building in southern China. This was very early in the pandemic. And this research was conducted by scientists in the southern city of Guangzhou. An article about the research was released in Emerging Infectious Diseases. And then peer-reviewed in the Center for Disease Control and Prevention. So one person was sick and did not know it. That's the blue dot there. 2 other families sat at adjacent tables with about a little over 3 feet in between each table. They were all there for about an hour. And what you can see, based on the air conditioner being on the right, the exhaust fan being on the left, is what you can see is that droplet transmission was prompted by air-conditioned ventilation. So the key factor of infection was the direction of the airflow. So that's an important thing to keep in mind as we are bringing outside air into these buildings as well. The other thing to remember with air dilution is it is not cleaning the air. It is not killing the virus. All it is doing is diluting how much air that virus is allowed to move around within. Now, the costs for this, of course, depend on your existing systems, but also on your area. You know, if you're in the South in the middle of the summer, it is difficult to bring in that much outside air because you have to condition it, which then also probably significantly increases your energy costs. So finding that balance is important. Next is air filtration. So air filtration only works if you can actually get the particles to the filter. So standard HVAC filtration can be good, but it's based on the filter itself. So it's as good as it's advertised to be. So MERV 8 is great for, say, construction processes to get out big particles that are in the air. But what we want now are HEPA filters, which can actually filter out those small particles like the viruses. So most of the particles that we're concerned about in this case are probably not even making it to the filter. And that's where bipolar ionization and particulate control are especially helpful because they're going to go out into the space and meet the particles. The difference there is that bipolar ionization goes out and actually kills the particles, and particulate control goes out and sort of gathers them and brings them back to the filter. So again, it only cleans the air. We're not diluting it here. We're filtering out these things for what actually makes it to the filter. The good news is that this is a system that can be constantly running in the background and will be constantly pulling in what it's able to reach. UV light. So UV light is actually inactivating dangerous microbes by destroying their ability to reproduce. So this is helping prevent the spread by kind of creating an inhospitable environment for bacteria, mold, viruses, fungi, and more. The far UVC light is a specific spectrum of the UV light that attacks airborne mediated and surface microbes. It is safe for human exposure and other animals, which means that it can be applied in a wide range of applications. Again, we all feel more comfortable outside because the sun is doing this for us. What we're trying to do is potentially recreate this indoors. We in particularly like LED lighting. First of all, it's much lower energy costs, but it can also be used continuously and unrestricted. And it's highly effective, but it's kind of the same as the filter in that it can't clean what it can't see. So if you have a desk and the UV light is above that, it is not going to reach what's under the desk in the shadows there. The other thing is that it has to be in that light for a certain amount of time. So it only kills what it sees, and it has to be seen for a certain period of time. Now, different lights can have different effects. So it's sort of a combination of intensity and time. So if you have high intensity, we might only need that dose for a few seconds. If you have a lower intensity, for 30 minutes. However, your choice as to higher or lower intensity might be based on the materials that are in the space as well, because this does degrade some types of materials. Now, there's a few ways that you can apply this, and one way that you're seeing here in this picture is a form of upper air UV lighting. So in that case, the UV is affecting basically the top third of the room, and that's a great example to be used for open office and classrooms, for example. But you don't want the UV running while people are in the space, so controls and interlocks are really important for that type of safety, and again, that material degradation. So, you know, while UV lighting is, it can be permanently installed fixtures, it could be mobile units, it could also be in HVAC units, but again, it's difficult there because they've got to, the light has to see those particles for a certain amount of time, and they move through those HVAC systems usually very quickly. This system really has to be planned out in the space very well to make it effective. It's a combination of the materials, the controls, where it's being placed, and how you want to use it. Contamination mitigation planning. So this comes down to design or even redesign of some of our spaces. Obviously, touchless fixtures. So the automated doors or the hands-free pull devices for doors, I'm seeing a lot more of those lately. Touchless elevator buttons, touchless plumbing fixtures, even touchless HVAC and lighting controls. Potentially real-time tracking technology and software to know how and where people are moving throughout the space. Having hand sanitization stations, marking 6 feet between common areas of congregation or backup. For example, in our office, we mark 6 feet away from the line for the coffee. There's also antimicrobial surfaces, which are both smooth surfaces or physical degradation or chemical surfaces. I'm a little leery of some of the chemical options, but I'm a great fan of just copper surfaces, for example, which cause the physical degradation of these viruses that sit on it. And then, of course, there's policies. So there's work from home or alternating entry policies. And more important is how you communicate those. So I don't know how many of you walked into a restaurant recently, and before you even walk in, there's like a barrage of signs that you have to read all these signs to figure out what their policy is before you walk in. That could be condensed into a much easier communicative situation. So setting those policies, branding your content and your messaging, not making it very overwhelming, all of those are important. Emergency preparedness programs for what happens when somebody does become infected, health service resources. Do you have sick leave to reduce presenteeism? Mental health support. Are you offering flu vaccines? A smoke-free environment? Again, smoke brings in just a ton of particulates into the space. Now, all of those are important, but most important is having management buy-in. We can't do any of that without the management and administrative buy-in and the financial support and the commitment to the ongoing enforcement. We have all been doing this so long, we're tired, but we have to keep going because the virus is still there. So some preventative maintenance programs, both for the equipment as well as for some of these policies are all very important as well. So how we design for contamination mitigation, you're seeing some images there on the left that give some good examples of that. You know, we might reduce occupancy, we might eliminate seating in some of our areas around our conference rooms. We have taken out a number of the chairs and placed sort of dots as to where folks are supposed to sit. You know, installing physical barriers if you have desks facing each other. Even better is to have them all facing one direction. Of course, continuing to use our masks. I'm in this space by myself, or you'd see me with my mask on. Having one-way circulation in some spaces, and definitely providing those hand washing and sanitizing stations. All of these are incredibly important, not only to make people physically safe, but to help them feel emotionally safe in these spaces as well. So I think probably during this, I have seen the most emphasis placed on cleaning and disinfection, which is those surfaces that we're trying to clean. This is probably not the prime way that the virus is transmitted, but it is still very important. So the first thing, and probably the most important, is to develop a green cleaning plan that addresses both interior cleaning and disinfection. Those are incredibly important. So doing things to support hand washing, reducing how many surfaces we're touching, improving those cleaning practices. You can do some fogging or using some misting equipment and then doing manual wipe down. You can also just do sanitizing and disinfection for where an infected person has been. And of course, negative air machines can help in that respect as well. When you're just doing your standard cleaning, when you're not trying to disinfect, there's really no need to use bleach on everything. There are many effective cleaners that also kill the virus: citric acid, hydrogen peroxide, etc. And if you're using fogging, hydrogen peroxide is a good one. There's also a dry mist coating that doesn't affect electronics. And of course, trying to limit that outdoor pollutants coming into the building as well through those walk-off mats, etc. Green Seal is a great website for finding highly effective but healthy cleaners that don't trigger those with asthma and whatnot. This is just an example of some of those antimicrobial or easy to clean or touchless fixtures. So very, very important as you're working through your cleaning process. So just as a reminder, this virus is very easy to kill. It's a lipid-enveloped virus, and it is very unstable. So you'll see that in the hierarchy of germ and pathogens to kill on surfaces, that it is at the bottom. So we're talking low-level disinfectants here. We're not trying to kill staph or some of these much harder to kill things. So all the more reason that we don't have to use those asthma-triggering chemicals as you might have to do in a hospital setting for other things. So IAQ testing is both a way, it's kind of a guide for us. It's a guide to know how much air dilution we need in the space, but also to tell us how effective some of our filtration methods are being as well. You can do these as one-offs with sort of handheld meters, or you can actually have it, you can send it off to a lab, of course, or you can take real-time samples. What I'm showing here is our Bonco, which is a great tool. It's just sort of a plug and play working through Wi-Fi, and it can also bring that data into ARC, and we're going to talk about ARC briefly as well. ARC is a building benchmarking tool that is used to report for LEED for existing buildings, for LEED for cities even, but also for a variety of net zero certifications. So ARC is a great way to benchmark, not just energy, like Energy Star Portfolio Manager, although ARC is free to use, like Energy Star Portfolio Manager is as well. But it tracks your energy and water through utility bills, a one-time waste audit, a survey of people to see how they get to the building and how they feel in the space, and then also does indoor air quality testing. So ARC actually has a re-entry program that is specifically designed to collect the information related to indoor air quality, people's experience, and then to be a stepping stone for the LEED Safety First pilot credits and the WELL Health Safety rating. So there's some great facility management, some occupant observations, and indoor air quality things that go along with that as well. This is what the ARC score looks like when you get all of your data entered, and is an awesome thing to put in the entry of your building, again, to help folks feel safe about re-entering. So you would start with plans and policies, developing those, then implementing them, then measuring the occupant experience and the indoor air quality, and then finally analyzing how well those are working and tweaking your plans and policies. Ultimately, you get a score that can then be communicated to your occupants and help you learn how to improve. So again, it can feed into the WELL rating system, the health safety rating, and into LEED for existing buildings. Really great program. If you haven't checked out ARC, I highly suggest it. So just in a very quick summary here, Integrity is a great resource for healthy and efficient buildings. We like to pride ourselves on being creative in helping to find the perfect fit for the client. We are consultants, so we're brand and solution agnostic. And we provide a variety of services for green buildings, commissioning, modeling, all types of building testing, but we can also be involved in lighting solutions, solar, water conservation, and even different types of financing methods. The important thing to remember when you're attacking COVID and how this pandemic affects your building and your workplace is that there are some short-term things you can do. Start with retro commissioning, figure out, kind of do an audit and figure out what you have and what you still need. And then your long-term implementation and management comes after that. But all of these issues could potentially increase energy consumption, UV, air dilution especially, and potentially filtration. So it's important to balance that with your financial capabilities. And there are a variety of funding options available. If you haven't done your LED light transition yet, you can use the savings from LED lighting, for example, to pay for some of these solutions. That's all we've got for you today, and we would love to hear your questions.
Well, I hope that flushed out what some of the other presenters were already talking about. And you may have asked all of your great questions to them, but we are available for questions. If I don't know, obviously, I'm going to punt to the real engineer here, John. So what you got?
April, I got a couple for you. First of all, thank you so much. A great presentation. Again, very fitting for today's world. And I loved how all of them tied together and kind of told a different story from different perspectives. One of the questions that came up was when we're replacing filters, how do we do so without harming our maintenance workers?
That's a good question. Obviously wearing gloves, masks, respirators, when we're doing those tasks are very important. UV lights inside of those systems could kill the surfaces, the bad viruses that are actually in those filters. Some of the other systems like the bipolar ionization or this particulate control that we're talking about, and we're actually studying that in our office right now, will actually kill the virus. So we don't really have a lot of concern about those viruses living in those filters for long periods of time with those technologies. But my recommendation is, just using gloves, masks, and obviously, the hygiene at the end of the work, making sure that, you're properly washing your hands and other surfaces and getting in your clothing.
Perfect. Thank you. And one more, we'll sneak in one more before we run out of time here, but portable HEPA filters, are these, are starting to get common? Are they a good idea?
Yeah, so same deal that Jim talked about before, and kind of what we've alluded to here. The particles are so small that we're worried about and you have to actually get those particles to those filters. So yes, HEPA filters will catch the virus, assuming that you can get that virus to them. It's a couple 10 feet maybe away from the HEPA, it'll pull it in. But what we really need to worry about with the bipolar ionization and other types of newer technologies is actually going out further in those spaces and attacking those particles or collecting them and bringing them to the filter. So yes, they're effective, but I think it need to be paired with some other technologies.
Maybe in really small spaces as well, right? So really small spaces where you can just put some fans in to help circulate, those might be just fine. But when you start getting into larger spaces, it really needs to be integrated with the building systems.
Awesome. Thank you guys very much. Keep the questions coming. Again, we'll store those up and we'll get them over to April, and we'll make sure they get answered. Right now, we're going to move over to our second of the roundtables of the day. And then after that, if you'll come back, we'll do our closing, and then Carrie will do a gift card drawing. So make sure you come back for that, and then we'll wrap it up at the end of the day. I hope everybody's had a great afternoon and enjoy this roundtable.